So before we go through each activity of daily living, I just want to give an overview as to how to complete the nursing assessments and care plans within this document. So for example, we look at ADL number 2, communication and pain. So you can see nursing assessment is highlighted in blue, and then the care plan is highlighted in green. So the idea is we do the nursing assessment first. So this here is a nursing assessment on the patient's communication. So for example, we've done this assessment and we've discovered that the patient has poor hearing, okay? So that might be an issue in relation to communication. So we want to write a care plan for this patient. So we go over to the care plan. The patient has impaired communication due to, and you document the reason here. So in this instance, the patient has poor hearing. The expected outcome is that the patient is able to use a form of communication to get needs met, okay? So here there's a list of pre-written interventions that may be relevant for this patient. So we go through each of these interventions and we activate whichever intervention is relevant for our patient. There are blank spaces at the bottom if we want to write in our own interventions. So introduce self to the patient. So we would need to activate that. Face the patient when speaking. Use any aids required. We're going to use the patient's hearing aid. Liaise with speech and language therapist. That might not be relevant for this particular patient. Allow patient to express feelings. That would be relevant. Liaise with the patient's next of kin. We may want to activate that. Engage the help of interpreter service. No, that's not relevant for this patient, so we won't be activating that. Give written information in patient's first language where available. So yes, we could give the patient written information if the patient has poor hearing, so we may want to activate that. Any other strategies adopted, we can document there, okay? So how do we activate these interventions? So you will see there's boxes across from each intervention with a box with A over it, an OR, an A, an OR. So A stands for activated, OR stands for resolved. So we want to activate these interventions. We go to the box across from each intervention we want to activate, and we initial and we date, okay? So the OR box is for if the patient had a problem on admission, but then it was no longer a problem and we wanted to resolve it, then we would initial and date under the resolve box. So a good example of that would be here in the elimination care plan. If your patient was admitted with a urinary catheter, we would be documenting the details here, and we would be activating each of these interventions here under the A section. However, if the catheter was removed during the patient's stay, then we would not need to be carrying out these interventions, okay? So this is not, the patient doesn't have an altered urinary elimination anymore, so it's not a problem anymore. So we can now resolve it. So we just initial and date under the OR box the interventions that we need to resolve. And then again, perhaps later on in the patient's stay, the patient needs to have a urinary catheter reinserted. Then there is space here if we want to reactivate a care plan. So we can come back here and activate again the relevant interventions for that patient. And again, if the catheter is removed again before the patient's discharge, then we can resolve it by signing and dating under the resolve box here. Another thing to note in relation to activating the care plans is that some of the interventions in the care plans are highlighted in yellow. Okay, so any of these interventions which are highlighted in yellow, they need to be activated on every patient. So for example, in this pain care plan, assess pain using numerical pain scale, pain assessment tool, record on news chart. So we do that for every single patient, so that needs to be activated for every patient. And post-intervention for elevated pain score, pain is reassessed and documented using appropriate pain assessment tool within 1 hour. Again, we should be doing that on every patient, so we initial and date that. Some of the interventions that we activate will never be resolved during the patient's stay. Okay, so as we go to the top here, in this particular care plan, the nursing diagnosis is the potential for patient well-being or safety to be compromised. The expected outcome: patient feels safe, secure and part of a caring environment. Well, we want that for all our patients throughout their whole stay, so that's not going to be resolved during the patient's stay. For this particular care plan, we have merged all the boxes together because all of these are relevant for all patients. So when you're activating this particular care plan, you can just have one initial and date. Okay, and as well, please note that in some of the care plans it'll be divided into different sections. For example, this one we put in together: 1B, dementia, delirium, depression, cognitive impairment; 1C, risk for falls; and 1D, other risk factors in relation to safety present and the expected outcome: the patient will remain safe and free from harm. So why we put these all in together is because a lot of the interventions overlap. So you might have, you might be ticking all of these boxes, or you might just be ticking, the patient might just be at risk of falls, but they may not have dementia, delirium or depression or cognitive impairment. Okay, and within each care plan there are blank spaces. So this is so you can write an individual intervention for your patient. The idea of these care plans is that they are individualized to each patient.